When it comes to knee replacement, most patients are concerned about doing it too early. But what we often see in practice is the opposite. Patients waiting until the knee has significantly affected the rest of the body. I'm Dr. Sean Leo, your friendly orthopedic surgeon. Advanced knee arthritis doesn't just cause pain, it changes how you move. Over time, walking patterns become altered, surrounding muscles weaken, balance and confidence reduce. These changes don't stay isolated to the knee. They affect overall function. So when surgery is eventually done, recovery is not just about the joint, it's about retraining the whole system. That's why timing matters. It's not about choosing surgery early. It's about recognizing when the knee is beginning to affect how you live and move. At that point, understanding your options becomes important because early intervention often means smoother recovery and better function afterwards. You don't need to decide immediately, but knowing where you stand gives you control. And in the meantime, keep movement going in a way that feels safe and manageable. Even small, consistent effort helps maintain strength and function.